I want to stop for just a moment and present Tim this image,
I
and then ask you, or even Joey, do you recognize this?
think he does.
What is it? What does this look like to you? What does this make you think of?
Looks like a heart.
Right. So this is the iconic, like, sort of cartoon image of a heart.
Mhm.
Um, Tell us, Tim, does this bear any resemblance to the actual human heart?
Um, I mean, someone unsure of himself like me might think so, but somebody with more experience like this little guy would immediately say no. That looks nothing at all
Jo-
like an actual human heart.
Joey's very critical of this cartoon image of the heart.
Yeah,
Even Joey knows, like, yeah, that's not the real thing.
no.
And so let's take a close look at this and see if they got anything right here. When we draw one of these cartoon hearts, well, we can say that it does represent the fact that the heart has two sides. There's bilateral symmetry there. There's a right side and a left side, and they have similarity to each other. There's also a clear difference between the structure at the top of the heart versus the bottom. There's sort of an implication there that there's sort of two little structures, kind of two bumps at the top, and then a larger sort of triangular portion down low. And that has some merit. Beyond that, this cartoon image of the heart is basically useless. It doesn't really look anything like a real human heart. We're going to go ahead and stipulate that at the top, those two bumps correspond to two small chambers that are called atria. Atrium for like a little entry chamber, sort of. And then down bottom, there are going to be two larger chambers that we call ventricles. Ventricle means a little belly. And these are the larger chambers and more muscular and more powerful chambers of the heart. Beyond that, since this cartoon version of the heart doesn't really have a lot of anatomic information in it, I'm going to go ahead and ask you to consider me as representing the heart. And so we're going to establish that if I'm the heart, let's say that from here up, these are the atria, right side, left side. And then from here down, you're looking at the ventricles on the right and the left. And the way the heart is situated inside the chest, first off, it's not quite centered. It's not also all the way over to the left, as we're sort of, you may have come to understand from uh, common knowledge. It is slightly left of center, kind of lined up with the right side. The right edge of the heart's kind of lined up with the right side of the sternum. Pretty much, if you place your hand on your heart as you would if you were, reciting the Pledge of Allegiance or standing in attention for the national anthem, it's pretty much right where you put your hand. And if you bunch your hand up into a fist, that's a pretty good approximation of the size of the heart and where it is in the chest. Okay, and then inside the chest, it's not standing upright like we see in the cartoon, but rather it's kind of keeled over onto its right side and then twisted to the left, kind of like this. So, with the heart in that position, leaned over that way, what we see if we look into the chest at the heart, for example, with a frontal chest x-ray, is the heart casts a shadow, a cardiac silhouette, so to speak. It's soft tissue, so it doesn't show up the same way that bone does, but you can see the edges of it. And what you see when you look at that cardiac silhouette is a right border that's formed by this chamber, the right atrium. You see an inferior border of the cardiac silhouette that's formed by the right ventricle. So the heart's sort of resting on its right ventricle. Um, Most of the left border of the cardiac silhouette is formed by the left ventricle. And then where's the left atrium? It's basically in back. It's twisted around to the back side. Okay, so you don't really see much of it at all. Now,
You should have been in Zoolander, Paul. What you really need to do is while you're still laid out like that on your desk,
yeah.
find a way to recreate a heartbeat and just have your desk explode all over you.
Well, we could definitely put some audio in there. Easy to put on. About Zoolander, I did audition. Ben Stiller edged me out. What can you say? So let's go ahead and take a look at one of those frontal chest X-rays because I know right now, just from the look on your face, that you don't believe me. Well, I'm not making it up. Here it is. That's a standard frontal chest X-ray from, I think, a normal patient, and you see the heart kind of you can see the evidence of the heart there in the form of a translucent white form, and the edges, which we call the cardiac silhouette, on the right side, that's mostly right atrium or entirely right atrium, basically. Along the bottom, it's mostly right ventricle resting on the diaphragm there. Okay? Um, The very tip of the heart, which is pointing out to the left, the pointy part of the cartoon heart, we refer to as the apex. Um, that territory actually belongs to the left ventricle, and then the left ventricle curls up on the left side, forms most of what you see along the left edge of the cardiac silhouette. And then finally, you might get a slight hint of just a little bit of the left atrium all the way at the top on the left there. And so that's what we expect to see in an X-ray. And you can imagine how the heart is sitting in the chest normally.